bar in the middle of the Zoom console to customize your view to meet your needs as well. To get things started this morning, I'm pleased to hand it over to CDPHE's Executive Director, Jill Hunsaker-Ryan. Good morning, Director Ryan.
Thank you, Brian. Hello, everybody. Thank you so much for joining us today. You know, tomorrow, March 5th, marks 2 years since the novel and deadly coronavirus was detected in our state. And I want to take a minute to introduce our team members on this call as we take a look back and also prepare for our future. We have Dr. Eric France, who's our Chief Medical Officer at the Department of Public Health and Environment, Scott Bookman, our COVID-19 Incident Commander, and Dr. Emily Travanti, who is our State Laboratory Director. You know, in looking back, looking ahead, I just want to start by acknowledging how far Colorado has come. This virus is so novel, and we've never seen anything like this in our lifetime. The fact that it's highly contagious, that so much of it is spread asymptomatically, and then its clinical expression varies from little or no symptoms to severe illness and even death in some people. And I think it's really hard for individuals to gauge their own risk level. The last couple of years have been historic, and we have faced the pandemic the Colorado way together, really from the combined response of state and local governments and the partnerships with the business community to the perseverance of parents and teachers, and the determination of individuals and communities to stay healthy and live their lives. As Coloradans, we know what it's like to scale mountains, and really, that's what we've done. You know, the complexities of this virus, including its nature to evolve, have made containment challenging, but our state response has been dynamic. We've had so many successes and are fully prepared for whatever the future holds with the virus. The state of Colorado's response has always been data-driven, which has allowed us to stay one step ahead of the virus. And I will show you some of our metrics today to illustrate where we are. And we've always carefully weighed our disease suppression strategies with their potential economic, social, and educational impacts that can have negative consequences to health and well-being. As a state, our guiding North Star has always been to protect the hospital system so that anyone needing a bed for COVID-19 or emergency surgery, trauma, or childbirth will have a bed. And we have been successful at this. Looking at this slide, since the beginning of the pandemic, Colorado's cumulative death rate has been lower than the US average. Of course, it's with heavy heart that we acknowledge and honor the 12,556 people who have died in Colorado due to COVID over the last 2 years. At the same time, Colorado has the 10th lowest COVID-19 death rate in the nation. And that can be largely attributed to our nimble response and the sacrifices of Coloradans statewide. This next slide shows where we are today in terms of the case count. Case counts have decreased to levels not seen since last summer. Omicron is so much more contagious than the Alpha and Delta variants, and luckily with milder illness in most individuals. So the most recent wave was high and short, and it left a layer of immunity behind. Now, we don't know how long immunity from the virus will last, especially in those who are unvaccinated, and it varies by individual. But between this and Colorado's relatively high vaccination rate, we know we should have much better protection heading into the warmer months and the end of the school year. Next slide. And the state's testing positivity level had a high peak and is now below our 5% goal at 3.6%. Next slide. Current hospitalizations from COVID-19 have decreased significantly since the Omicron peak and are back to last summer's levels. I think you can see from these slides why the governor says, if you are vaccinated and boosted, go live your lives. Now, we will need to continue to monitor variants of concern, and we are prepared if a more contagious variant outcompetes Omicron or is better at evading our immune systems. We also don't know the level to which immunity will wane by next winter, and if you will see a significant winter wave. But these are our scenarios that we are planning for and will be ready for. Next slide. And finally, I wanted to show you this slide. The School of Public Health has been providing modeling data to us throughout the pandemic. And due to the asymptomatic nature of COVID, they have attempted to estimate our true epidemic curves, including the infections with no or mild symptoms that are not detected through testing. On this slide, the light purple indicates the total number of infections per day modeled by the school, and the dark purple line is infections detected through testing. And I think this really serves to illustrate the contagiousness of the Omicron wave and the true magnitude of what we have faced really throughout the pandemic, making where we are today even more special. I will now hand off the presentation to Dr. Eric France to talk about the ways Colorado has protected itself throughout the pandemic and some key milestones. Dr. France?
Thank you, Director Ryan. It's hard to believe it's been 2 years that we've been living through this as a state. As Director Ryan has shared, we have spent 2 years battling this unpredictable virus, and now we plan to prepare for a future in which COVID-19 remains a part of our lives. These past 2 years have brought us an unprecedented public health emergency, and we built and scaled our public health response in a way we had never seen before in order to meet the moment. We were able to expand our testing across the state. If you remember, we could only do 160 tests a day in March of 2020 and quickly scaled up over 300-fold to do 50,000 tests per day. Coloradans have received more than 2.5 million free at-home testing kits through the mail and at community pickup locations to protect themselves and their families by being able to test at home when they felt ill or before attending holiday gatherings. We're grateful to have life-saving COVID-19 vaccines available to us. And over the last 14 months, nearly 4 million Coloradans have completed the primary series of a COVID vaccine. And Colorado is 11th in the country for people getting their third or booster dose to stay up to date with this protection. We know that COVID-19 is going to be with us for the foreseeable future, and all of our experiences over the last 2 years have prepared us for where we are now, a time made more optimistic by the availability of vaccines and therapeutics. As Coloradans return to more normal lives during this time of low disease transmission, we will continue to monitor COVID-19 in the state and remain ready to surge our public health response if the situation changes. One of the ways that we are going to follow COVID-19 in Colorado is by the work of our state lab. Our state lab director, Dr. Emily Travanti, has led this team from the start of the pandemic, and their work monitoring COVID-19 helped Colorado become the first state in the country to identify the Alpha variant through genome sequencing, and the third in the nation to identify the Omicron variant. Dr. Travanti and her team at the state lab will continue to play a critical role in tracking COVID-19 and any potential new variants in the state. I'd like to hand it over to Dr. Travanti to talk more about that work.
Thank you, Dr. France. We have learned so much about COVID-19 over the last 2 years, and this knowledge has informed our efforts and helped us to create and maintain a robust statewide COVID-19 surveillance network. Our past efforts provide us with important infrastructure that allows us to keep an eye on COVID-19 in Colorado while people look forward to enjoying summer and spring activities. Our state laboratory has been running 24/7 since the beginning of this pandemic, analyzing tests and sequencing more than 108,000 positive results to ensure that we have the best information available about how and where COVID-19 is circulating, while tracking variants of concern here in Colorado. As Dr. France mentioned, the efforts at our state laboratory have kept us at the forefront of the nation for early identification of variants in our state. Next slide, please. Colorado has been among the leaders nationally in wastewater surveillance. Wastewater surveillance is important because we can identify the presence of a virus in a community before we have results from clinical testing. Using this method, we were able to estimate trends of disease within a community because it can capture data on individuals who are asymptomatic or who may not seek testing. It also allows us to sequence wastewater samples to monitor for the presence of COVID-19 variants of concern in specific communities. We originally started the wastewater surveillance program with 21 participating utilities, and we are excited that this program has nearly doubled in size to 41 utilities that collectively serve 55% of Colorado's population today. This encouraging increase in participation gives us a broader ability to look at early warning signs of increasing community transmission in areas across the state. Wastewater surveillance is a powerful tool for ongoing monitoring of not only the level of COVID-19 in a community, but also as this early warning for changes in the virus, allowing us to continue to watch for signs of new variants without requiring asymptomatic people to seek treatment and testing. The combination of sequence surveillance from both the clinical and the wastewater samples will provide an ongoing understanding of how COVID-19 is impacting our communities. I'm so proud of the work that our teams have done over the last 2 years, and we remain committed to tracking COVID-19 in the state to help inform the public in the coming months. Director Scott Bookman is here now to talk a bit more about the COVID roadmap forward.
Thank you, Dr. Travanti. Thank you all for joining us here today. As Executive Director Ryan indicated, we are at another turning point in our response to COVID. It has been 2 very long years, but Coloradans have come together to allow us to move forward. And we're at a point now where disease rates are low and getting lower by the day. We have high immunity from vaccination. And so we are at a point where we can begin to look forward to the next step. And so last week, we rolled out our roadmap to move forward. And while members of the public who are up to date on their vaccine and aren't vulnerable will have the ability to move forward with their lives, we want the public to understand that behind the scenes, our teams will continue to move forward, preparing for whatever may come from COVID or any other communicable disease or disaster in the future. So there are 4 key pillars to our roadmap: hospital readiness, public health preparedness, healthcare workforce expansion, and engaging in federal government reform. Our hospitals have been incredible partners over the course of this pandemic, and they have scaled to meet the needs of the moment. We have also seen great partnership from our long-term care facilities, behavioral health institutions, and pharmacies and primary care. We're at a point now where we have a lot of tools available to us, particularly these new therapeutics. And it is critical that we start normalizing COVID into the traditional healthcare system so that people who test positive for COVID are immediately connected with the therapeutics that can reduce their risk of hospitalization by up to 90%. We need to make sure that our hospitals have a predictable, reliable amount of surge capacity so that we can always scale to meet the demands of whatever future waves of COVID or any other illness may require from us. And we need to ensure that the entire healthcare continuum is staffed and can meet the needs of the moment. So that includes looking at staffing in our long-term care facilities and looking at our behavioral health capacity as well. I'm going to go a bit in a moment into more depth on pillar number 2, but I'll skip to pillar number 3 right now. Our frontline healthcare workers have been the absolute heroes on the front lines here over the last 2 years. But this pandemic has taken an enormous toll on them. We're seeing people leave the profession at high rates. And so we need to partner with our institutions of higher education, with our healthcare providers to ensure that we are creating a pipeline and getting people into helping healthcare professions to ensure that we have the ability to take care of those who have COVID or any other illness into the future. Then obviously we can't do this alone. COVID is a national and an international problem. And so we need to work with our federal government to ensure that all the reform efforts that are needed occur. We need uniform guidance on surveillance in our most at-risk populations. We need to look at areas where we have seen potential price gouging in staffing contracts. we need to look into the future of long COVID and make sure that at a national level, investment is made in research and treatment for long COVID. And then obviously, public health readiness and surge capacity. On the next slide, I want the public to understand that behind the scenes, your public health system at the state level and with all of our local partners, we will continue to prepare for whatever the future may hold with COVID. We will make sure that we are updating all of our disease investigation and surveillance systems so that they are ready to determine if there's an increase in any type of COVID cases out there. As Dr. Travanti discussed, we will be looking into continuing to expand that wastewater surveillance or whole genome sequencing to make sure that we have the most up-to-date information on what this virus is doing and where it is headed. We'll continue our outbreak prevention and response activities in our most high-risk settings where people live in congregate settings together. And then obviously we continue our vaccination and other efforts in our most vulnerable communities. And so we will continue our mobile efforts in bringing buses to locations where we can meet people where they are to get the vaccines that they need. We'll also look into what is the impact of indoor air quality in our schools and in other public settings where we can continue to provide ongoing protection for the public. And so this is the work that we will be doing behind the scenes to monitor where COVID is and where it may be headed. On the next slide, we will maintain capacity to scale to meet the demand of the moment if it is required. And so we will be able to scale up our mass testing sites again, our mass vaccination efforts, our distribution of therapeutics, and then working with our emergency management system and our emergency management partners to make sure that we have a stable stockpile that we need of critical equipment to protect Coloradans as soon as it becomes necessary. So as we move forward, as the disease rates allow us to do so, we will continue to do all of this work behind the scenes to make sure that all Coloradans. With that, I will turn it back over to Executive Director Ryan.
Thank you, Scott. Well, in summary, we really are in a good place. The state is prepared for a winter wave should immunity wane next winter. If there is another variant of concern that emerges, but we still do want people to get boosted or get immunized if they are unvaccinated. This will certainly help us as we live with COVID-19. And we really just want to thank the people of Colorado for their diligence, for practicing safe behaviors and listening to public health guidance and getting vaccinated. And yes, who can believe it's been 2 years, but we're very optimistic at the state. And with that, we have a few minutes for question and answers. I will turn it back over to Brian to help facilitate that.
Thank you, Executive Director Ryan. We will open things up for media Q&A at this point. We can use the raise hand function. You can find that feature along the bottom of your Zoom console. Let's start with first questions first. If we have any time allowing at the end, we can circle back for follow-ups or second questions. Please state your name and outlet before asking your question. And if there's anything we're not able to get to here today, please email us at media_info@state.co.us. Let's go ahead and get started with Sarah Flower. Go ahead, Sarah.
Hi, good morning. Thanks so much for taking the call today. I'm curious too, this is Sarah Flower with KDUR. When we talk about this maybe a surge coming on while we're enjoying this lull right now, is there a metric that the state is looking at, whether that's positivity rate or hospitalization, that says we've got to switch gears into surge mode? Thank you.
Yeah, well, I'll start if I can. Certainly, it's going to be a combination of measures, and CDC is actually working on some new types of measures for what we might be focusing on. We'll be, of course, looking at positivity rates, but they may not be what they used to be, as fewer people get tested or use home testing and don't report into the state. That means we'll be looking also at hospitalizations. What we're hearing from our emergency rooms and our hospital systems? Are they seeing more respiratory illnesses? I think it's an important message for all Coloradans to remember that since we don't have a lot of COVID in the community now, if you do become ill, we would like you to go get tested. And if you test positive with a test kit at home, please consider getting tested with a PCR test that would be reported into the state. I think it's all of our duty to be looking for any sign of new COVID cases. And if you have symptoms of a respiratory illness over the next year, please go in and get tested so that we're counting you and we're capturing the data you're providing us as part of our tracking system.
And I'll just say, you know, part of Colorado's data-driven response, our state epidemiologist daily has a dashboard that she updates where we're able to see number of new cases, number of new hospitalizations, number of deaths, percent positivity of tests. And over time, you can really see trends and you can tell when things are starting to increase and how quickly they're starting to increase.
All right, let's go to Alex Rose. Go ahead, Alex.
Hello, thanks as always for hosting this call. Obviously, as we shift to the endemic stage, that wastewater surveillance system is going to be key in detecting community spread, especially if people are kind of lulled into a sense of comfort and maybe not necessarily going out to get tested proactively as much as they are when levels are high. It's great that you guys have expanded from 21 facilities to 43, but looking at the map, there are still a good amount of communities. I'm thinking specifically on the western slopes like Grand Junction that aren't necessarily, it looks like, signed up for this stuff. So what is the state doing to expand wastewater facility testing, and what are you guys doing to make that system more robust as we shift into the endemic stage?
I can take that one. So we are actively working to increase the number of facilities that are submitting samples to us. We have additional capacity. So it really is just establishing these relationships and getting additional facilities looped into the entire logistics program of bringing samples in. We're also exploring the opportunities to do additional testing more at the facility level or building level, which would give us a window into some of the micro watersheds instead of just the community-based surveillance. So this is an ongoing expansion. We're at 41 sites right now. We look to see that increase over time.
All right, let's go to Meg Wingerter.
Hello, this is Meg from the Denver Post. I had a question. You know, you've talked about if you're vaccinated and boosted and a relatively healthy person, just go ahead and live your life. But if you're, you know, a relatively healthy person, if you have a compromised immune system and such, or something like that, what does this mean for you? Do you just have to, you know, stay apart for indefinitely, or what is guidance for you?
I'll be happy to jump in there, Meg. It's a great question. I think everyone's going to have to make their own decisions about what risks they're comfortable with. Good news is now we have about 6 cases per 100,000 population in the state of Colorado. So when you walk out your door, the probability of being exposed to somebody is quite low. So your risk is low to begin with baseline today. That can change with future potential increases in case numbers, but right now they're pretty low. And so everybody should say, well, given it's low, what am I comfortable with? I have an immune compromised person at home, so I'm going to wear a mask when I'm in a grocery store, or I might limit going to large events because I don't want to take even a small risk. Others might say, I'm comfortable with that risk and I'm going to live my life normally, even with a person with some immune compromised condition at home. It really becomes an individual decision about risk comfort. Recognize that right now our risks are all pretty low. Some have lower tolerance for any risk and will take extreme measures of protection, and others are more comfortable with taking on more risk. So it will be based on these individual decisions.
All right, let's go to Seth Kleiman.
Hi, Seth Kleiman from the. So CDPHE held a presser on this exact same day last year, talking about light at the end of the tunnel. Vaccine had been out, cases were down. What makes this anniversary, the tone of y'all's perspective now different than that? And will we be here having this same sort of press conference in 12 months? Thanks.
I can start with that. The thing that we've seen in Colorado with this virus is it definitely goes down in the winter as, there's warmer weather, people go outside and kids get out of school. I think the thing that makes it different this time is that Omicron is, it's less severe. It's a disease that's less severe. We have a much higher level of vaccination in the state. There are great therapies available, antivirals and antibody treatments. And, Omicron is so contagious. The School of Public Health estimates that the beginning of January, between 1 in 10 and 1 in 15 and people in Colorado were infectious. So it's given us a layer of protection. And certainly, we've seen in the unvaccinated in particular, immunity wanes over time, but there is a level of protection right now. And all of these things have converged, I think, to put us in the best position that we have ever been in with this virus. I'll see if Dr. France has anything else to add.
I think that's right, Jill. We are certainly at a place, again, where the risk for an individual walking out their front door is much lower than it was a year ago. The fact that people are out and about and there are not increasing cases of hospitalizations suggests that there aren't a lot of people out there to spread this virus to. And so that suggests a very high level of immunity in our communities right now. And that level of immunity is quite a bit higher than it was a year ago, March 5th, 2021. So I think that has us feeling more positive about the short term and the low risk that our Coloradans have when they're out doing and living their normal lives.
Let's go with John Daly.
Hi there, John Daly, Colorado Public Radio News. Thanks so much for taking our questions today. I'm wondering if you could speak to the funding and how much do you estimate this next phase of dealing with COVID will cost the state, and how does that compare to prior funding? And do you feel like you have enough? Where will that money be coming from?
So, John, over the course of this response, the vast majority of funding has been pushed down to us from our federal partners. There have been, significant grant disbursements made, through our CDC channels. And then additionally, 100% FEMA reimbursement has been available, throughout the course of this pandemic for our surge activities. And so that FEMA funding has been extended through the end of June. And so we will continue to meet the needs of Colorado using that funding, and then we will continue to reevaluate as we move forward.
Let's go to Jennifer Meckles. Go ahead, Jennifer.
Hi, everybody. Jennifer Meckles from 9 News. I'm just looking for Colorado's perspective on a national issue I saw covered earlier this week when it comes to basically like the expired or leftover vaccine doses now that interest in the vaccine is so much lower than this time last year. Number one, what is the shelf life of a vaccine? Does Colorado have like a number yet of how many we've had to toss because they've expired or you couldn't use a full vial? And then just how do you manage that as a state, trying to make sure there's not too much waste when it can be prevented? Thanks.
Well, the good news is that our waste in Colorado has been lower than national experience. I believe just under 10% of all doses nationally have gone to waste. And, to give some perspective in that, we were encouraging people to be vaccinated. And if you had a patient in front of you at 6 o'clock at night that wanted to be vaccinated and it required you to puncture a vial of 10 doses, with the potential of wasting 9 doses in order to vaccinate that one person, we were encouraging that activity to occur. And so we would expect a certain maybe higher level of waste given the urgency of getting people vaccinated. Our own wasted weight rate as a state has been running around 4%, so more than half lower than what the nation has experienced. And I think that's because our care providers have been very careful about trying to make sure every dose counts and not waste doses. We've been very careful about making sure that we ship out those doses that are more likely to expire in the coming months. Each vial has its own expiration date, and at the state level, we can track those expiration dates. Sometimes they may be changed as the pharmaceutical companies understand the shelf lives are better over time. And so it's a constant management of inventory that helps us achieve a rather low rate of vaccine wastage in Colorado.
All right, let's go back to Alex Rose.
Hey there, Alex Rose again with Fox 31. Obviously, you know, the president during the State of the Union announced a new approach with testing and treating. And obviously that announcement is just a couple days old. So I know the state doesn't necessarily have all the logistics of that federal program ready to go. But I am curious if anybody could talk about those antiviral treatments that Colorado has in stock. What does that supply look like? And can the average Coloradan expect to be able to go to a pharmacy or a health facility right now in the state if they test positive for COVID and be able to get one of these? Thank you.
I'm happy to jump in here again. We do get shipments every week of antiviral therapies. The numbers continue to be small, and we look forward to a day when the pharmaceutical companies are producing large numbers, and these are highly available in pharmacies prescribed by local physicians. And in the meantime, we're distributing our doses on a per rata basis on population size. So areas with a lot of people will get more doses than parts of the state that have few individuals. I'm looking forward to seeing more about this immediate test and then treatment at the pharmacy. I'm sure there will be many requirements that you must not have this, that, or the other kind of condition, and only healthy individuals will probably get their doses through a testing and treating strategy. Those who may have other medical conditions, it would be wise that they meet with their healthcare provider to talk about whether the medication is right for them. So I know there'll be more coming to talk about the details of who will be qualified, who will be encouraged to see their doctor to make a shared decision with their doctor about treatment therapies.
Let's go back to Meg Wingerter.
Hello, this is Meg from the Denver Post again. When you were talking about the North Star of preserving hospital capacity, so it would be there for people with COVID, people who were having medical emergencies. And I wondered, we managed to do that, but people had to put off a fair amount of non-emergency care that was still important. So going forward, still the plan, or are you hoping to preserve a greater amount of capacity to deal with some of that important but non-emergency care?
Well, I think that is, the critical component of, the roadmap and moving forward is working with our hospitals, our healthcare system partners to ensure that we have the capacity to do all of the regular things and surge to meet any future needs of COVID or other illnesses. And so that is a key component of that roadmap and what we'll be working on as we go forward.
All right. Thank you, everyone, for joining today. Thank you, Executive Director Ryan, Director Bookman, Dr. France, and Dr. Travanti. If there are any questions we weren't able to get to during today's press conference, please email us at media_info@state.co.us, and we'll get back to you as soon as possible. Thanks again for joining. Have a great rest of your day.